Well, good afternoon, everyone. This is Marwan Abelzoud, Director of the Transplant Institute, and I want to welcome you to another lecture from our Transplant Institute lecture series. And today we are lucky to have Dr. Lisa MacLean, who will be talking about helping healthcare workers manage burnout. Now, we have talked about this before in several forums. And the one thing that unites us all as healthcare providers is the awe we have for medicine and the passion we have to deliver care for the critically ill. We thrive on those healing relationships and the humanism that comes with this. And transplantation is particularly unique in giving us those opportunities to deliver the service we want and derive the joy and the personal and professional satisfaction from the work that we do. Now, the one thing that we all notice, either during our early stage in career, mid-career, or even during difficult times like now, that we may become unhappy. And unhappiness is somewhat in stark contrast to the sense of joy and vocation that called many of us to get into transplantation. So this is what brings us to the concept of burnout. The concept of burnout, people may use it as burned out and what have you, but this actually was studied scientifically. And it was initially described as something that is associated with a state of mental or physical exhaustion and depletion because you've committed so much of your personal resources into something that did not give you back the sense of satisfaction or that stressed your systems beyond you being adjusted to that. We talked about Dr. Christina Maslach, who structured the Maslach burnout inventory that talks about emotional exhaustion, where you feel mentally depleted, psychologically depleted, emotionally having no reserves, and also having this a sense of cynicism about you, where you lose your empathy, and also feeling low about yourself and low personal accomplishments. The concept of burnout took so much attention that the World Health Organization has put it together in the ICD-11, and it conceptualizes it as something that results from chronic workplace stress, and it's not been successfully managed, and it's not to describe you or the individual as having disease, but a response related to those chronic work-life stresses. And certainly having the pandemic around us did not make it better. It has stressed all of us, our families, our friends, our patients. It has rattled the cage in a significant way. So on top of the burnout we have the other pandemic, which is the real pandemic, which is COVID. And many people would say that nurses on the front lines got even the bigger brunt of it, even than physicians. Now, our transplant centers and our team, and Michelle Jesse, whom you all know, and Dr. Asselman and myself studied burnout among transplant surgeons in the United States. And we find that about 40% or so suffer from emotional exhaustion. And that's pretty significant. And we knew that it correlates with difficult patient interactions, excessive work hours, and also not having support from your coworkers. And we studied the burnout also among transplant coordinators, and Kathy Hogan was with us on the study. And we find emotional exhaustion to be a 50%, whopping 50% among transplant coordinators suffering from emotional exhaustion. It had to do with the difficult patient encounters, excessive work hours, the pressures of work, and the coworker support. So now we say, well, we have all this in the pandemic. What should we do about this? Certainly, there are many things we can change in the workplace, and we're working on that. But there are tools and ways of how collectively we can do work on burnout and how to improve the health of our employees and our teammates. And this is where I want to thank Dr. Lisa MacLean for the work she's done with her team at Henry Ford Hospital and Henry Ford Health System. Many of you, Dr. MacLean, who is a clinical psychiatrist and the director of physician wellness at Henry Ford Health System here in Detroit. And she develops programming to assist physicians and residents in optimizing their coping strategies and finding good life balance and to maintain the delivery of quality care. Now, prior to joining us in 2017, she was Associate Dean of Student Affairs and Career Development at Wayne State University School of Medicine. And Dr. MacLean has had a long relation with Henry Ford Health System. Many of you may not know. She was previously with us, where she worked in the Department of Behavioral Health, and she served as Psychiatry Residency Program Director and Chair of Graduate Medical Education Committee and the Director of Education for the Psychiatry Department. On a personal note, I've worked with Dr. MacLean in various capacities, and I've been with her and talking to her throughout the COVID pandemic. I have not seen a more committed, more energetic person who cares about the well-being of our healthcare workers and our partners. She's a dynamo. I think sometimes I always joke and say she's a nuclear energy. But without further ado, let me give the microphone to Dr. MacLean, my friend and colleague, to talk to us about how to manage burnout. Dr. MacLean, the microphone is yours.
Thank you, Dr. Abelju. That was such a great introduction, and I really appreciate it. And I couldn't agree more with all of your comments today in terms of the background regarding burnout. You might notice that in my title, I didn't say how we avoid burnout. I intentionally, I think, changed that word today to manage, because I do think that we knew that about 50% of physicians in particular, and even high numbers of APPs and nurses were struggling with burnout prior to the pandemic. And I'm really concerned to see how those numbers have shifted and potentially worsened as a result of the pandemic. I think many of you can identify with this physician on this in this picture, just really looking out. And I think really we've been asking ourselves, what is happening to the world and what is happening to medicine. So let's dig into this topic. Hold on. There we go. So just to let you know, I have no disclosures. So what we're going to talk about today is we're going to have an opportunity for you guys to self-assess your current well-being. I do hope that today's talk will be interactive, that it might even be a little bit fun. I think it's tough when we're talking about a serious topic like this, but I think if it can be engaging and have good energy, that hopefully you can take away some positive tips. So if you feel like you want to change your name to something else so that you can be more anonymous, feel free to be Mickey Mouse today as you attend this 1-hour session, whatever you feel. But I will be asking you to participate by using the chat. I'm going to go ahead too and introduce a framework for burnout mitigation. And then we're going to actually probably spend most of the time talking about some of the resources that we rolled out during COVID that continue to exist. And then I really hope to have some dialogue with you at the end of the presentation to try to better understand, what are we missing and what else do we need to do in order to provide support to you. So again, I think that many of you can identify with this picture. We've been seeing a lot of this on the medical floors. I think many of us, I know I did, when the vaccine started to roll out, I began to feel hopeful. Some of that exhaustion that I began to feel began to lift. And then as we now enter into the fourth surge, we're really seeing that exhaustion reemerging. And it's attached to a lot of anger that people are experiencing. And overall, I think we can all agree that we have experienced, as a result of this pandemic, extreme stress and at different times, actually trauma. So this is a really interesting slide. My EAP colleagues during the peak of COVID, we asked them to put together a word cloud of what they were hearing from our colleagues, what they were hearing from our employees. It didn't really matter what role the person played in the organization, but they began to say, well, what are the words that you're hearing that people are talking about? And so the bigger the word on the word cloud, that means the more they heard this word in their encounters with our employees. So you see a lot of different words on here that maybe many of you can identify with: guilt, fear, stress, frustration, anxiety. You even see the word traumatized. And then obviously the biggest word on here that you see is really a sense of being overwhelmed. And I think that that sense of feeling overwhelmed has shifted and morphed throughout the entire pandemic. So I thought that this was a really interesting slide that I just saw recently and thought, oh my gosh, I have to put that in a presentation. This is really, I thought really telling. It's a slide that looks at, it was developed by Everly and his group, that looked at disasters and the predictable psychological patterns. So they looked at other, not necessarily pandemics, but other disasters, medical disasters, and just regular weather disasters that have happened, and saw that there's a process for healing. And when I was looking at this, I thought, okay, where are we? Certainly we saw the impact. We saw the frontline heroes and the heroic part. I think during the last summer, we might have, things began to slow down a little bit. I think we thought, oh, okay, the vaccine's going to happen. And so then COVID hits again, I think, in the second and third surge, and we definitely see a lot of stress and fatigue. I think people continue to work through or try to work through battling their grief. But I wonder, do you think, and feel free to put it in the chat box, do you think that we're working through our grief, or do you think we're adjusting or rebuilding? Or are we actually still in the disillusionment phase of this process? I feel like I would have said we were in restoration until the fourth surge hit, and I'm really wondering if we are actually in restoration. Does anybody have any thoughts on there's no right answer here. I just think that we create a shared story and a shared narrative, and I just wondered what people thought where we were at in this process of healing. No problem. No problem. It sounds like you're quiet out there, but don't be shy. Please feel free to participate. So many of you might recognize this. There's so many different. Tom chatted in and said he still felt like we were in the disillusionment phase. Thanks, Tom, because I agree with you. And the community absolutely is especially fatigued. And that's when we're seeing them not really follow the rules and the regulations. It has to do with that pandemic fatigue. There's actually been some stuff written about in the literature called pandemic fatigue and pandemic anger, and all of these new terms that I think are emerging as a result of how we see the pandemic impacting healthcare workers, but the greater good people in general. And so as we think about the pandemic, we think about the impact of stress, it's like all over the place in terms of how stress can impact us. It can impact us emotionally, cognitively, physically, and behaviorally. And this is obviously in varying degrees in each area, and that each person is going to be wired a little bit different. Some examples of the reactions that we witnessed during the first surge, even now, I think, continue to be, feeling confused or depressed or anxious. At work, many of us, I think, confronted moral dilemmas, moral distress, unrelenting work hours, the demand for doing more with less. At home, many of us had, especially early on, just an extreme amount of fear about impacting our families, needing to be separated from our families in order to keep them safe, and really that disconnection from our support systems, which we know is just so critical to your well-being. So I just think that it's really important to acknowledge just all the different ways that stress impacts us, and to know that that we need to manage all the different ways, the muscle tensions, the moments of confusion. I know for me, one of the things that I've never had before, but really came about during this pandemic, is a tightness in my shoulders and in my neck. that's actually caused weakness bilaterally in both arms, because I think I'm holding things so tightly and oftentimes literally feeling like I have the weight of the world on my shoulders. And I'm sure many of you can identify with that as well. So I want to acknowledge that living through this pandemic has caused an extreme amount of stress. I want to acknowledge that working in healthcare can sometimes be brutal. And on the screen, obviously, is just some of the stressors you might be feeling. This is not all inclusive. And I'm sure that you could find a lot of other things that you could add to this list. All the pebbles, all the rocks, all the boulders that get in the way of our daily work and really drive our distress. So in terms of, I love this picture. So you can imagine this could be a nurse or this could be a physician, but at the very center of this kind of downward spiral is, what do you see there at the very center? Is a cartoon of COVID. So I think that many of us have felt like things are just slowly spiraling down the drain. I do think it's important that I acknowledge that there's an extreme amount of stress that people are feeling, but I also want to say that I think that some people, it's gone just kind of beyond I feel stressed out to really being traumatized by these events. Some signs of secondary traumatic stress include having like excessive worry and fear, feeling easily startled or on guard, racing heart, chest pressure, muscle tension, nightmares, and recurrent thoughts about these events and the trauma related to these events. So I guess I just wanted to introduce that to have you just begin to think about, am I experiencing secondary traumatic stress as a result of these most recent events? And to really think about, there's really two ends of the spectrum. At the end of this, are we going to be traumatized? Who's going to be traumatized? Are we going to have more healthcare providers experiencing PTSD? Are we already seeing it? I was part of a research study that we're just putting together the final touches on our paper. Many of you might have been asked to participate in the study, and we definitely found that there is a subset of our colleagues who are experiencing PTSD as a result of the events. We saw it. Our paper will show that we saw it most commonly in our female colleagues. It appeared to be worse in our nursing colleagues, and we saw it significantly more in some of our younger colleagues, some people who were just transitioning into their very first job. So these are the colleagues that I think, of course, we want to be concerned about everybody. Interestingly, we did see those who were the most traumatized sought out more services than were not traumatized, which we were really glad to find that finding. But we also found, and our study was over a 6-month period, that unfortunately, in spite of those resources, that even at the end, they were still traumatized. So as you look at this slide, I put PTSD kind of in red and post-traumatic growth on the other side. So really thinking about, okay, at the end of this, am I going to be traumatized? Am I going to have PTSD? Or can I be in a space where I actually, I look for the silver lining, or I look for the ways that I can stretch and grow and be resilient, that I can take away from these events some of the positives or some of the ways that I can stretch and grow as a person. So that's, of course, one of the things that we're really trying to introduce, this idea that people can actually grow as a result of traumatic events. So as I think about resilience and promoting growth, as you look at this slide, of course, we don't want people to just withstand what they've gone through, and we don't want them to just recover, but we do hope that ultimately we will see thriving in the face of this adversity. We know that regardless of the role that you play in the organization, that you are resilient. there is absolutely no question that healthcare workers are resilient. And so certainly I don't want you to take offense to the fact that we're talking about how do you make resilient people more resilient, or how do you make strong people stronger? And so I want you to think of it from that perspective, that in no way does anyone, including Dr. Applejood or myself or any leadership, think that the burnout that you might be experiencing or the trauma that you might have experienced as a result of this has anything to do with weakness on your part, because it doesn't. So I want you to think about, I told you I was going to ask you to do a self-assessment. I'm not going to ask you to share this in the chat box. I want you to think about these two questions. And these come from the Maslach Burnout Inventory, and they've been highly, depending on how you answer this, it's been highly correlated with whether or not you're burned out. So the two questions are, I feel burned out from my work, or I have become more callous towards people since I took this job. And the answers are either never, a few times a year, once a month, a few times a month, once a week, a few times a week, or every day. And so if you answered this with a few times a week or every day, then it's highly predictive of being burned out. Okay, so let's talk about a study that I thought was really interesting, and I wanted to introduce it to you. And I knew that I was going to have like a diverse group of people that would be on this call today. So this was a study involving 80,000 healthcare personnel. And this was pre-pandemic. This is just talking about how to manage burnout and build resilience. And so this sample included 19,000 nurses, 5,000 physicians, and 60,000 non-nurses or non-MD personnel. And it was across 40 healthcare systems. And they studied two characteristics. And I'm going to actually ask you, this is where we're going to do the participation part. You guys are going to be asked to measure your activation and your decompression. So they studied two characteristics that they felt were particularly related to how you managed burnout, or whether or not you could avoid burnout, and how you could manage increased resilience. And those two characteristics, one was called activation. And this was the extent to which a person is motivated by his or her work. So you might have seen prior to the pandemic, Henry Ford, we began to do work where we were asking people, what is your why? Do you remember that? Where they were asking people, and there was some videos, and they were really inspiring. Well, this is the activation piece. You know, like, how connected are you to your meaning and your purpose and your why? The second characteristic that they measured was decompression. And that was the degree to which you can withdraw, recharge, and really have, like, separate yourself from work. Like, how are you in terms of really rebuilding yourself when you leave the workplace, so that you, you feel healed and energized when you re-enter back into the workplace. And they found that these two characteristics, both activation and decompression, were highly correlated to engagement. So if you had high activation and you had high ability to decompress, then you are more likely to be satisfied as an employee. You are more likely to say that I like where I work and I would recommend that other people come here for care. And you are more likely to feel like, yes, I am a Fordite. I work for Henry Ford Health System and I bleed blue blood, right? That you would be so proud to be part of this organization. Okay, so let's go ahead and have you, I want you guys to measure this. And I'd like you to, if you want, to put in the chat box what your number was. Because I think it's so interesting. I've done this with other groups, and I have found a common theme. So I'm really wondering if we'll see it with your group today. So it's 4 questions, 5 points, and 5 is strongly agree. So the questions are, the work I do makes a real difference. So 1 would be strongly disagree and 5 would be strongly agree. My work is meaningful. I care for all patients and clients equally, even when it's difficult. I see every patient as an individual with specific needs. So I'm going to go ahead and put in the chat box what my number is. And then maybe that'll, showing my vulnerability, maybe others will show theirs, but I'd be curious to see, because I have an idea, I have a theory about you guys, and I want to see if it holds true. So I'm going to put my number in. Wow, Marwan is really activated. Thanks, Marwan, for sharing. I'm not as quite as activated as you, Marwan. So wow, Sula too. I was really honest with myself. Not that you guys are not honest with yourself, but I was really honest to say, I don't know if I could say 555 across the board. I'm definitely, I think I'm more of a 444. Thanks, Tom. Tom's in the boat with me. Thank you, whoever that person was. Thanks for sharing. There's someone in it with me, also at a 16. Anybody else willing to share? Awesome, another 16. It's really interesting because I have done this with different groups of people, including nurses and other employees in our organization. And Henry Ford employees, I think the lowest number I've seen is 15. So we are, I think, and it's so, I think, interesting when we kind of think about, I've worked for Henry Ford Health System. This is my 3rd time working here. And these have been the mottos that we've had the times I've worked. Each patient first, just say yes. Yes, we can, and all for you. Right? We are a completely very patient-centric organization. And I think that that's one of the reasons why we see such high activation across the board of people in our space. Okay, so now it's not wanting to advance. There we go. Whoops. Okay, so now I want you guys to measure your decompression, because this is another thing that I saw as I was asking people these questions. So how are you doing in terms of your decompression? Again, 1 to 5. So the questions are, I rarely lose sleep over work issues. I'm able to free my mind from work when I'm away from it. I can enjoy, yes. Yes, I think we're going to see Dr. Singh or Ashina just chimed in, and I think we're going to see a theme here. So Ashina chimed in and said 7. So I'm gonna put my number in there too. Oops. So that Ashina doesn't feel alone. Yeah. So both Ashina and I, we identify with each other. Oh, Michelle's doing better. She's 11. Oh, Marwan. Oh, Marwan. What does that even add up to? It's not very high. Yeah. So do you see something here? I see something. I think that that's just really, really interesting. And let me go on to tell you a little bit more about what this is. So, hold on. Okay, so we already kind of said what's your score. We saw that Henry Ford Health System transplant associated people had really high activation, but we were really struggling with our decompression. There might have been a few people in there that are really good at decompression, but that was actually not the norm within our group. So what this study found was that they saw that people who had higher scores for both actually tended to be more resilient. But they also said that lower scores, like lower decompression scores, for example, was actually not an individual red flag. That was a red flag related to the organization. And that that it could be something that our organization in some ways expects of us in terms of being connected all of the time that makes it more difficult for us to decompress. So I thought that that was really interesting. They also found that activation and decompression vary amongst different groups, but that regardless of the role that you played in the organization, so if you are in environmental services, it is really important that you're connected to that why. And that you know that I'm cleaning that room and it's all about patient care. So they found that that was really, really important. They also found that non-nurses and MDs really needed interventions that were focused on activation. And they also saw that people who had, that physicians in general seemed to struggle most with compression, and that these two things seem to be correlated with each other. So I just thought it was interesting. And the remainder, not the remainder, but we're going to talk a little bit more about your activation and your decompression and how you can change it. So kind of what does this all mean? And so I think you already kind of heard me say that I think it's important to your well-being to be connected to your meaning and purpose. And there's been a lot of research actually that's looked at this outside of the study that I just showed you. In fact, Tate Shanafelt did a body of work where they said if you spend 20% of your time doing the work that matters to you the most, that it will exponentially decrease your risk of burnout. So having, working in a culture, being part of a health system that has us think about what our why is and has us focused on both our activation and our decompression is going to be really important overall, helping us manage our burnout. So what do we do with that? So let's kind of talk about it. Again, using the chat box, I would love to have a shared story with you. Again, I've done this with other groups, and it's so interesting to see what people put in the chat box. So the question is, what matters to you most in the work that you do? Because this is our why. So use the chat box and share. I'm going to put mine in. What matters to me most in the work that I do? Put it in the chat box what you think. So what do you guys think? So I put in there providing top quality safe care. Patty said, hold on, Patty said, having patients and staff validate the value, yes, of what you do, because it's just so life-saving, saving lives while having people be well and having and being happy doing this. I'm adding some more things here. Being part of a team that really cares. And I think it's not just that really cares about me, but also supports me, respects me, collaborates with me. What else? What else do people think? I'm going to put another one in here. Doing work that really matters, helping others become their best, having purpose and fulfillment and making positive impacts on people's lives. Helping someone in a health crisis the way I would want someone to care for me and my family. Thank you, Patty. I think that that is so important. Creating challenges and persistent learning, even amid tough times, like stretching ourselves, growing, having that kind of growing edge. Yeah, so what's so great about you guys, I think, chiming into this is it really shows our shared story. There's so many, I think we can all identify so much with so many of these things in this chat box. Okay, so thank you for sharing. Uh-oh, I think I've now turned on, I accidentally turned on the, there we go. Okay, so I think when we think about our why, it's really thinking about our values, right? It's really being in touch with that meaning and purpose. It's living a life that you are in touch with your values. And I think all of these things that you wrote coincide very much with who you are and what you're all about and the values that you bring to work each and every day. And so it's really our values, I think, that become our life compass. They're there to really guide us on this journey of life, but we never get there, much as like you never get truly west. And we oftentimes have to kind of refocus and move the directions and pivot and tweak so that we constantly are moving towards what we believe to be our true north. And so I guess I want you to ask yourself as you participated in that little exercise, are you connected with that meaning and purpose? Is this something you do think about? Are you activated? Are you living your values? Are you practicing medicine in a way that allows you to live your values in a really in a concrete way? Because I do think that that is one way that we cope that helps us when times are really difficult, is really being connected to those values. Okay, so now moving on to decompression strategies. And so again, I think in an effort to create a shared narrative, I'd love to kind of hear from you. What are some ways that you're decompressing and de-stressing at the end of the day? What are people doing? Now I'm going to go ahead and share what some of the things that I've been doing. And I can't wait to hear from you guys, because I think we give each other ideas. There's been times I've done this, I'm like, oh my gosh, that's a great idea. I'm going to start doing that. So let me see. Giving the best I can to each patient. So what else are people doing to decompress? Okay, so we have exercising, we have walking your dog. I think being out in nature is particularly helpful. And we've had some incredible weather. Tom is going for walks with his daughter, he specifically put. And I agree, when you can spend that one-on-one time with your kids, it's just so nice. Exercise and meditation, cooking and eating. Yeah, I mean, that can both be positive and sometimes not so positive. I heard that the average weight gain during COVID was 12 pounds. And I actually think that I hit the average weight cutoff. I've been calling it the COVID-19 because it's the 19 pounds we gained. But kayaking, so Marwan admitted that he might be overeating a little bit too. Someone went camping. Oh, that was you, Marwan. Baking. Oh, I've tried a ton of new recipes, and that's been really fun to try out new things with my family. Oh, the other things that I've been, I'm type A, and so I've been doing puzzles, and that's been kind of a nice compulsive activity for a compulsive talk. Oh, thank you, Kelly. That has been something. So when I was a kid, we didn't have a lot of money. I grew up in very humble roots, and so we used to go for car rides, like my family. We would just go in the car and go for a ride, and that was kind of the entertainment for the night. And during COVID, my husband and I did that. That we went up to the Thumb, and we drove over to Gross Eel, and I don't know, it was just really great to kind of get back to. We played a bunch of board games with our kids, movie nights, listening to music. Yeah. So Rosalind said shopping, and I feel like that can be positive or negative. I definitely see that my online shopping has really increased. So thank you all for your ideas. It sounds like a lot of really good, some mostly healthy decompression activities, some maybe not so healthy. Okay, so let's move on to the next slide. So in terms of decompression and really investing in ourselves, I think part of the struggle is sometimes really finding that self-compassion for ourselves. And it's really learning to hold ourselves kindly and being kind to ourselves and investing in ourselves. And I think docs and healthcare providers notoriously have a hard time with this. And you saw in our numbers that you guys were much better at activation than you were at decompression. And so I think that there's something which I call intentional self-care. Because, it's so interesting that I see a lot of nurses and medical students and residents and some of our faculty as patients. And I remember seeing one nurse who works in a high acuity frontline role. And she said, I know when I'm eating right and I'm sleeping good, I feel so much better. But it was really hard for me during the surge to focus on that and to really invest in myself, even though I know that it's really important. So I think you have to be intentional there. I said that, and Marwan immediately picked up his water and started drinking because he realized. I have heard that as we age, our brain shrinks, and so we need to keep well hydrated. And so that was great, Marwan, that you're drinking plenty of water. Because I think keeping hydrated, taking breaks, making sure that you get good sleep, maybe thinking about what you're eating for lunch and making sure that you're fueling your body. I felt like Marwan wanted to say some sort of comment to my poke at him for drinking his water. Marwan, do you want to say something?
I just there's a little bit of echo, so I apologize. I think the brain shrinking phenomenon just got me to chuckle a little bit because I don't mind having a scotch every now and then, and that's starting to get me worried.
Yeah, thank you, actually, Marwan, for bringing that up because, certainly we've seen, and I think I should mention, certainly we've seen some unhealthy behaviors and self-care behaviors emerge during COVID. There's been nationally an increase in domestic violence. There's been nationally an increase in substance abuse and use. And I think that that's regardless of whether you're a healthcare worker or not, but we definitely have seen some data that's supporting that alcohol use has also increased in healthcare workers as well. So we all cope in different ways, and I think it's really important to pause and really think about of the things that we're doing to cope, what are the things that are really going to bring us closer to that, our values, and what are some of the things that we're doing that are going to bring us further away. So in terms of, that self-kindness, that compassion, I also think connections are just so important. I just couldn't help, had to include, I call us PAC. Those are my parents, my husband, and my two kids who just turned 21 yesterday. But I think our people at home, our people at work, our patients, and our own focus on gratitude can be very healing and can help us to manage our burnout. So really being mindful and intentional about those connections is just so critical. So let's move on to our tools. So during COVID and even now, we continue to create resources. And so I want to make you aware of, if you're not already aware of, some of the tools that you can have in your toolbox that might resonate with you, or even if they don't resonate with you, make note of them because maybe it's a tool you want to lend to one of your colleagues if you see that they're struggling in particular. So many of you people, I did get permission to use this photo. Many of you might recognize Dr. Oddish in the photo, but one of the things that emerged, and we've kind of done it a little bit in today's presentation, is that shared story that we all have. But we really found that Frontline Diaries as a narrative medicine intervention, it had over 100 submissions. It continues to be open. We're still looking for stories. These stories have been archived, and ultimately I wonder if someday we'll publish those stories to say this was our story, of COVID. But they're essays and pictures and even videos. But I think for many people, journaling or writing can be very, very cathartic. And so I really encourage people to use that as a way to just connect with others and to process some of their feelings. Another intervention that we developed, and this came after the surge because we got a lot of feedback that we really needed to think about doing interventions in the weeds. That we definitely in our research study showed too that virtual interventions were not enough, that we really needed interventions that were at the point of care. So we developed peer processing groups. These are small, in-person, or they can be done virtually, but for the most part, they've been done in person. These have been pretty much since June of 2020, we have had over 100 peer processing groups with different teams across the organization. Basically, they're co-led with one of our team members from the Heal and Recover team and a leader within your work sphere, with usually 5 or 10 of your team members, with the idea of really just sitting down together in a small, intimate, maybe a large size room so people can space out, but really processing feelings around the pandemic and talking about that shared story. Oftentimes it was really funny that, maybe not funny, but just interesting or ironic that we heard feedback from people who said, I thought I was alone in the way that I was feeling. And then we sat down to have this shared conversation. And I found out that the person who's sitting right next to me, they had the same worries. They had the same concerns. And it felt really good to know that I wasn't alone. And so that was something I think that these peer processing groups help to accomplish. But in addition, it gave us an opportunity to introduce this idea of post-traumatic growth. And it helped to have dialogue about what are the ways that we can stretch and grow? What have we learned? How can we pivot? How can we begin to heal? So if any of your work groups are interested in potentially doing a peer processing group, then please reach out to either me or Wendy Goldberg. Another thing that our organizational effectiveness team is doing that many of you may be aware of or may have been asked to participate in is something called after action reviews. So Jason Sheffer and their group, the organizational development team, will come in if you feel like you'd like to process with more of a focus on quality improvement your work area. They can come in and do an after action review with you guys and really give you some ideas about how to move forward. In addition to that, if you haven't already met Julie Hamilton, she's incredible. Actually, Marwan was on our search committee when we hired Julie 3 years ago. We hired Julie to see healthcare providers with her core focus on residents, fellows, and our physicians, but she's really expanded to see really any clinical people. She does a 3-week, each session is 1 hour in person or virtual workshops that are on stress and burnout resiliency that use ACT as a basis and theory. And ACT is acceptance, commitment, treatment, and it's a really great strategy that we have found to be highly effective in mitigating burnout, but also during COVID. It's really been our primary approach as we try to work with our colleagues to prevent burnout and help them deal with the trauma of these most recent events. So if your team, your work team, Julie will do it in larger groups and smaller groups. But if you guys are interested, I wanted you to know that that resource is out there. The other thing that I wanted to remind people of is we did develop, it was probably now about 4 months ago, a Stronger Together Buddy program. What's been really, we've had about 200 people sign up for this, and we are still, you can register at any time. We've been doing post-survey to see, what did people think of the Buddy program. And we've had, I think, about 60 or 70 responses to that, and only one person was negative. Only one person. And so I look at that and I think that is an effective intervention. And so basically the basis of the Buddy program is you can either sign up with a colleague or you can sign up as an individual and be paired with someone else. And you make a commitment that you are going to email your buddy or text them, whatever you guys set up, for as long as you guys want to. But that on a weekly basis for 12 weeks, I will send you an email that will have a micro skill and a weekly challenge that you can do with your buddy, or you can do broadly kind of with colleagues or even in your home. And so far, well, I had 2 buddies one that we, especially during the first surge, we texted each other every single day for almost 4 months. And it was super powerful. And then my other buddy, we started probably in the second surge, and now we're probably going on 6 months. So we've been texting each other every single day for 6 months. And it's really been an incredible, and it doesn't have to be anything. It might just be, hey, have a great day, or hey, what are you doing for self-care today, or whatever. But it's been really, really great. So I do think that we can offer support to each other, and it's a great way to do that and build your toolbox as well. Okay, so my last couple of slides, and we're almost out of time. I'm sorry, Marwan, is I want to make sure that everybody knows that we do have a peer support program called TRUST, which stands for Treatment, Respect, Understanding, Supportive Care, and Transparency. So the TRUST program is a peer support program after a critical or unexpected patient care event, which I think must happen sometimes in transplant medicine. We have 20 physicians trained, we have 10 APPs trained, and we have 11 nurse trust partners. So if you are part of a unexpected event and you are looking for peer support, you can call EAP and they will contact me, who will then set you up with, depending on if you're a physician, with another physician, if you're an APP with another APP, or if you're a nurse with another nurse. Or if you're a nurse, you can look on the nursing wellness webpage for the referral. Or if you're a physician, you can look on our physician wellness webpage, or it is also on ESSER. So there's a variety of different ways that you can make that referral to the TRUST program. Once I hear that a referral is needed, I reach out to that trust partner, who will contact the second victim or the person who's been negatively impacted via email to invite them to a conversation, which that person is not required to participate in. They can, or they can say, sorry, I'm fine, I'm not really interested, or they can say, yeah, let's set up a time to talk. So we try to be there to be supportive, but at the same time respect that not everyone wants to have that conversation. And then this is my final slide, just to make sure that people know that EAP is there, behavioral services, we do have a crisis line, and then the National Suicide Prevention Lifeline and Crisis Text Line numbers are on there as well. So, sorry, Marwan, I thought that I would be able to talk faster than I actually was. So that's all I got. It looks like we have about 5 minutes left for questions.
Well, thank you, MacLean. This is fantastic. I think you hit it spot on. You engaged the group, and it was time well spent. We have 5 minutes. Please put in questions in the chat box. We can ask Dr. MacLean. In the meantime, I may pop one question to you. We have been promoting and advancing mindfulness activities as a way to develop, gratitude and self-care, managing anxiety and positive, outlook and relationships. Do you have any thoughts on that?
Absolutely. And, I should have included that throughout COVID, and even now, we continue to have weekly mindful moments. I know Kelly Bryce, I think with Michelle Jesse, did some mindful moments with, I think, Anne's filling in here and there with your group specifically. I think that mindfulness work and meditation work is so helpful to so many people. I know it's not for everyone, but I think those people who can really engage in that sort of coping strategy find it to be really helpful to them.
Thank you, Lisa. Any questions from the group?
So someone just chimed in and talked about it's Patty, and I couldn't agree more. This isn't really a question, but just to really acknowledge, I think, all of the challenges. And it hasn't been, thank you, Patty, for really chiming in to say, hey, Lisa, it's not just about the pandemic. There's also all of this other stuff going on with racial inequity, diversity, and inclusion, and politically, and our world has just gone through a lot in this past year. And she indicated that she felt like it has really increased people's reactions and maybe it really impacted their ability to cope because they're just all of these things are just weighing so deeply and so heavily, you know, on them, both in their professional and in their personal lives. So that's an excellent point, Patty. Thanks
Yeah.
for bringing that up.
No, I think this was a very strong point, Lisa, because I think the current events that are now trickling through in relation to racial inequities and the impact of the pandemic, at some level, may be questioning our fundamental principles as a society. And we, as you mentioned earlier, we depend on our values a lot to be anchoring and keep us steady. So I think that in this context, I wonder what your thoughts are on the additive component of challenge, in addition to having non-judgmental conversations and perspective taking and the ability to just have an embrace among all people of all colors and all backgrounds, wherever they are.
I'm not exactly 100% sure what the question is, but I will say that I think there's a significant overlap between DEI work and wellness work. And I don't think that you can necessarily do wellness work in particular without considering DEI work. Like, how can we really promote learning environments or working environments that are healthy and promote well-being if they don't also have equity and inclusion and diversity within them? So I know that I'm sure that many of you are aware of the health system hired Dr. Martina Caldwell, who just started as the Director of Diversity, Equity, and Inclusion for the medical group on March 1. And she and I have already had multiple conversations, and we're actually going to be sharing a project manager. So I do think that the system really recognizes that there's overlap for this work, and that she and I need to be working very closely together to make sure that we are aligned, because it's just so important.
Question was put up by Tom regarding moral injury. Do you have any thoughts on that?
So it looks like the
As a
question, I'm
framework.
looking at it as, yeah, what are my thoughts about the term? Yeah, I guess I really look at them as two very separate things. I think certainly people can be burned out and not be injured morally. However, I do think that if you are injured morally or you have moral distress as a result of your work, that's going to increase the likelihood of you being burned out or even potentially leaving medicine. So, I mean, we all went into medicine with, I think, some very inspired, it's the why, the activation stuff. And when we can't do that work, when there's all these barriers or walls that get in the way of doing the work that matters the most, I think that leads to a lot of moral injury, and obviously can also lead to secondary burnout as well. But they're not absolutely synonymous, at least in my opinion. And I don't know, Marwan, do you have anything you would add to that?
Yeah, my thoughts is that moral injury is an insult, and it's graduated insult that could be repetitive. And I would think that the extension of this insult can lead to burnout. But burnout is kind of a stage that you've arrived at. And so I think that moral injury is a phenomenon that gets you there, but it's not the there. And there was a grand round that was presented here in the Department of Surgery by one of our transplant surgeons, Dr. Kavarghese. And he talks about the model of the moral injury as being something that came out from the military and basically with the Vietnam vets. And basically, it's something that when people bear witness to or fail to prevent an act that transgresses our moral belief of putting the patient first. So that kind of gives you an idea of the moral injury. Certainly, when we encounter complications, we feel guilty of that. It's kind of like the second victim phenomenon. But it's not restricted to medical errors only, but it's how we get treated and how we get interacted. But that's a very good question, Tom. Maybe we should have a grand round on that.
I agree. And one of the things I did review that grand rounds, it was excellent. He talked a lot about peer support programs and the importance of those. And so for us, that is our trust program. So just want to remind people that that's a really important resource that we work to really develop, and that you know, we really want to help our colleagues. So thank you. It looks like it's 1 o'clock. I really
you.
appreciate
Well,
it.
I want to thank everybody for attending. And Dr. MacLean, I cannot thank you enough. And we're going to have you back again to this group, hopefully with the next stage of more well-being and wellness resources.
Anytime, anytime. Take care.
Wonderful day. Thank you for your work. Bye-bye.